Yeah.
start, sir. Yeah. And
Okay.
the meeting will be recorded. So you can start. And when you feel like just stopping because there is only one student, you can just
Hmm.
wind it up. That's all.
Uh-huh.
We'll
Good.
see. I think after 5 or 10 minutes, some more may
Uh-huh.
join.
They will join. They will join.
Yes,
Yeah,
yes.
definitely.
You may
Okay, ma'am.
start, sir.
Uh-huh. Sure.
Yes, sir.
Thank you.
Oh,
Okay. So, good afternoon, one and all. So, today, now in this session, we are going to discuss about psychodiagnostics. So, yeah, when we talk about psychodiagnostics, so there are different psychologists, philosophers who have given their opinion on the term psychodiagnosis. So, according to Atkinson and Woodworth, 1987, diagnosis is the process which includes both determination of the nature of abnormality or disease and the classification of an individual on the basis of disease or abnormality. So what they said is, they said that in diagnosis is classificatory process in which what we are doing is we are trying to understand the nature of abnormality or disease and the classification of an individual on the basis of disease or abnormality. So this is by Atkinson. Then we have another definition. Psychodiagnostics refers to the process of classification information of an individual's emotional and behavioral state, and the name assigned to the state generally based on the commonly accepted classification system. So another definition says that it's the process of classifying information of an individual's emotional and behavioral state. So whatever emotions an individual is showing and the behavior they are showing, on that basis, when we name, which is generally based on common accepted classification system. So that's what psychodiagnosis is. The psychodiagnosis presents the global functioning of individual process, provides assessment. So in short, in summary, psychodiagnosis is when how we are going to diagnose a psychological disorder. Okay, that's what psychodiagnosis is. When we are going to understand the disorder, diagnostic criteria. In our block 1 introduction we have, okay, so over the last century the scope of activity of clinical psychologists has increased exponentially. In earlier times psychologists have a much more restricted range of responsibilities. So if you see few years back, it was very difficult to find a psychologist. Nowadays, you will see there is a good number of psychologists everywhere available. Even now, they have kept it mandatory. Even in colleges, schools, they have kept counselors, health institutes, other organizations, even psychologists are there. Today, psychologists not only provide assessments but treat wide variety of disorder. So it's not limited to do the analysis part, to use some sort of tools, to use some sort of scales to identify any sort of psychological disorder, but they are even trying to treat various disorders in an equally wide variety of settings. Consult, teach, conduct research, help to establish ethical policies, deal with human engineering factors, have a strong media presence, work with law enforcement in profiling criminals, and have had increasing influence in the business world and in the realm of advertising. to identify just a few of the major activities in which they are engaged. So psychology not only deals to understand just the psychological disorders, it plays an important role uh, in various fields like law enforcement in profiling criminals. So if you might have heard about lie detector, or you might have heard about other psychological tests which helps us to identify the criminal behavior. So if you remember, there was one case of few few years back, in Delhi case, there was a person who cut his partner in pieces. So then there was a forensic team who have done elaborated research on that, because media have portrayed it in different way. But there was a famous criminal psychologist, forensic psychologist, Dipti Pornik. She gave one interview and she suggested that it is not because of any sort of religious or anything. It is because of the mental condition that person has. Okay, so psychology plays even more important role in such cases to revolve or to sort it out. Okay, it also has increased influence in the business world, advertising. Psychology plays a very important role in advertising. If you see, small new example I will give you. Nowadays, I used to see in college going kids, they will be carrying bottle which has now pipe, and it is written 200 ml, 300 ml, 1 liter, 2 liter. So that is how earlier also we had bottles, but now it is in trend. Everyone want to have that measurement. Everyone want to have that pipe. It is easy to drink water. uh, that's the way how we can give the advertisement and how we can enhance the business. Okay. Intelligence tests, personality tests, behavioral assessments, and clinical interviews all yield potentially important information about the person being tested. So either it is intelligence test, personality test, or behavior assessment, or clinical interviews. They have the potential about understanding the important information about the client or the person they are testing. But none of these techniques provide an overall assessment of the examinee's level of functioning. Even though these all tests are not going to give the full exam assessment about the client's functioning, in other words, no individual test provides a complete picture of the individual. Even when we are consulting to a physician, he will ask us, even for blood there are n number of tests, even for urine there are n number of tests. So same time way, even in psychology we have personality tests, that too n number of personality tests. So one test can't give us each and every profile of the client. It provides only a specific piece of information about that person. So each particular test will give us particular information about that client. One major task of psychologists involving in assessment is to evaluate information provided by many tests. So the major task of a clinical psychologist or a psychologist is to have an assessment and to evaluate the information provided by many tests. Interviews and observations, not only tests, including interviews as well as observations, and to combine this information to make complex and important judgments about individuals. So when we are consulting to a doctor, so we take a hemoglobin test, blood test, and all. So then doctor is analyzing all the tests. What is a lipid profile? What is cholesterol level? What is blood sugar in fasting after having something? So each and everything they will be analyzing. Then only they are going to diagnose something. Same way in psychology, if a person is coming to me, we will be doing some sort of tests. Can be personality related, it can be IQ related, it can be performance related, it can be anything else. So after analyzing each and everything, then only we can diagnose, okay, this is the issue with the person. So these all tests, these are screening tools, help us to pass an important judgment about the individual. Kraepelin also gave definition about psychodiagnosis. So what he said, it is a process that uses a number of procedures. So one process which uses number of procedures intended to tap various areas of psychological functioning. which includes various areas of psychological functioning, brain functioning, personality functioning, and so on and so forth, both at conscious and unconscious level. So they also mentioned that both at conscious as well as unconscious level. How unconscious level, that we will discuss ahead later. For example, when we are doing interpretation of dreams, or when we are doing any sort of qualitative test like Rorschach or like TAT, using projective techniques as well, or as more objective and standardized tests. Even projective techniques as well are more objective and standardized tests. In both cases, interpretation may result on symbolic signs as well as scoreable responses. So in both, either it is objective test or it is projective test. Okay, both will lead some sort of findings with the goal of describing individuals in personological rather than normative terms. So in by using both these, the goal is to understand the individual's problem rather than normative terms. So we need to understand what is going with the person. Testing, assessment, and clinical practice. Since the early 1980s, the practice of clinical psychology has shifted strategy from an emphasis on assessment and diagnosis to an emphasis on psychotherapy. So earlier in 1980s, usually clinical psychologists have shifted emphasis on assessments and diagnosis to psychopathology and adjustment. So, White and Baker 1977 survey suggested that over 85% of practicing clinical psychologists use psychological tests, and that over one third of their therapy times who devoted to test administration and evaluation. So, majority of the psychologists, clinical psychologists, are using much time in testing than therapy. Pattern of test use have been quite stable since 1970s and probably will remain so for the foreseeable future. Psychological testing appears to be a common activity regardless of the psychologist's therapeutic orientation. Even though psycho, uh, even though there is a therapeutic orientation for behavior change, for cognitive change, but these testing helps the psychologist to understand first some traits, characteristics of the individual, which will help them to use any sort of therapy effectively. The most widely used clinical tests can be divided into three types: individual tests of general mental ability, personality tests, and neurological tests. So these are the three categories usually commonly clinical tests are categorized in. First, an evaluation of general mental ability often is crucial for understanding an individual behavior. So initially, when evaluation is done, it is little bit crucial for understand the individual behavior, since many behavioral problems are linked to the intellectual deficits. So there is a interconnection between intellectual deficit and behavioral issues. Second, individuals' intelligence tests present an opportunity to observe the examiner's behavior in response to several intellectual demanding tasks, and thus they provide data regarding the subject's persistence, maturity, problem solving styles, and other characteristics. So these tests give the observer or the clinical psychologist the idea about the behavior, why this person is like that. So actually, the three main goals of this is observation, explain, and to change it. So observation is why this student is late in class. Explain. Observation is I find somebody coming late every day to class. Explanation is what would be the reasons: missing a bus, waking up late, and change. Change is how we can work on that behavior to modify that behavior. Same way it happened here. Okay. Then we have, thus they must provide data regarding the subject's mutual. Okay. For example, Wechsler's intelligence scale, Weiss and Weiss, and the Sanford Bill Billet represents the most popular test of general mental ability. So these are the famous IQ tests which gives us mental ability, IQ score. The Rorschach, the thematic apperception test, TAT, and the Minosta multifacial personality inventory, MMPI, represents three of the most popular personality tests. So it talks about the popular personality tests as well as the intelligence tests. The Binder Gestalt is issued in the assessment of perceptual disorders and organic dysfunctions, although it may be used for a wide range of diagnosis purpose, whereas the Luria Nebuchadnezzar battery provides a wide-ranging assessment of perception, motor, and intellectual functions that might be affected by damage to specific portion of the brain. So then we have gestalt psychology. Gestalt psychology have done a lot of work in terms of perceptual disorders. So to understand the perceptual disorders, we have two, three tests to understand the perceptual, motor, intellectual functioning of an individual. Variable domains of psychological assessment. So, what are different domains of psychological assessment? Psychodiagnostic assessment methods have been developed for a wide spectrum of trait and state variables affecting human behavior. So, what are traits or what are variables are affecting human behavior? We have been developed a lot of psychological tests which help us to understand that. Following a proposal by Cronbach 1949, one distinguishes between performance and personality measures. The former referred to measure of maximum behavior a person can maintain, the latter to measure of typical style of behavior. Intelligence tests are examples of performance measures, a test of extroversion, introversion, or trait and so there is a correlation. Sometimes we say if there is high attendance, there is high performance. If there is high attention, there is high performance. So that's what correlation between variables. So in this example, a farmer was referred to have a test and later to measure the style of behavior, which style of behavior they have, and individual intelligence test were examples of performance measure. Uh, Test of extroversion, introversion is great. So when we need to understand the performance of an individual, we can go with intellectual tests and personality tests like introvert, extrovert, introversion, extroversion. Right? These are personality tests. Okay. Performance variables. These includes measure of sensory processes, how your sensory process are working, sense organs, how they are taking the message and taking, how senses are working. For example, tactile sensitivity, visual accuracy, color vision, proficiency, auditory intensity, threshold, perceptual aptitudes. So these all help in actually performance. Who will in a class there are 100 students. Teacher teaches all the students same slide, same material, but still some students get high marks, some students get low marks. It is there is a variability. What is the reason behind that? So these all factors plays very important role, including how you are paying your attention on the uh, eye contact, the auditory intensity. So these all factors plays very important role. Perceptual aptitudes, textile tactile texture differentiations, visual closure, visual or auditory pattern recognition, memory for face, visuospatial tasks. So in this also we have visual closure. So if you are watching a movie and if I ask about any scene, you will be able to answer. Why? Because when you are asking watching a movie in a hall, you are paying for that, and you're purposefully going and paying full attention to watch that, because there will be curiosity, and it has the domain of like visualization. So you it will be usually it has been identified that people has more visual memory as compared to other memories. So measure of attention and concentration. Again, we have these are again the factors which plays important role. Psychomotor aptitude, including a wide variety of speed of reaction, task design. For example, I am dictating something, you are typing that, writing that. So how is your psychomotor aptitude? That will vary on that. Some students write so fast. Some students always say that we did not get time to finish the exam or to mention all the questions and all. It depends on the psychomotor aptitude. Measures of learning and memory, assessment of cognitive performance and intelligence. So next to general intelligence, a wide range of primary mental abilities like verbal comprehension, word fluency, numerical abilities, reasoning abilities. So these all factors plays very important role in understanding. Measures of different aspects of creativity, of social and emotional. Creativity again, same similar variable which helps us to understand. Personality variables. These include the assessment of primary factors of personality. You might have heard about big five factor personality traits, introvert, extrovert, that comes under personality. Data sources for psychological assessment. So, what are the data sources for psychological assessment? By a rough estimate, more than 80% of all published assessment methods will be questionnaires or objective tests. So, mostly a psychologist usually uses questionnaire or objective tests. As we shall see in this session, the range of possible assessment data source extends considerably further through. And in a practical assessment work, two psychologists tend to complement, cross-check, or simply expand their assessment by some or several non-questionnaire or non-test methods. So sometimes what we are doing is we are collecting data by semi-structured questionnaire, structured questionnaires, unstructured questionnaires through interview method. There are these are the major sources in psychology to collect the data, either questionnaire method or objective testing. Act- Actual and biographical data. This category refers to descriptive data about a person's life history, education, professional, medical record, possibly also criminal record, age type. Okay, so this includes demographic data. Demographic data means your age, height, weight, you belong from socioeconomic status. This all is as well playing. Why we need these all demographic details? Because majority of disorders have the criteria like uh, so in morning class as well we were discussing this particular disorder is 5 is to 1 ratio, 5 boys and 1 girl. So there were other disorders as well which are more in girls than boys, so it varies. That's why demographic variables plays very important role. So some disorders are specific to age. Alzheimer's disease, which age we are going to diagnose that? It won't be 10 years. Schizophrenia. So each and every psychological disorder has particular uh, age range, gender related this thing, gender related factors are affecting it, and how your development has been, life history, education, social life, professional, medical records. So these all plays very important role in this. Oh. Then behavioral traces. This refers to the physical traces of human behavior and handwriting specimen, products of art and expression. So sometimes we will be asking a question like draw a man, draw a tree. So through drawing also we can understand the anxiety, we can understand the personality traits of an individual. So how we can observe the, how we can trace the behavior. It can be by asking them to, like, whatever they are interested in, right? So product, for example, some, if you might have watched the movie Tare Zameen Pe, in that the teacher is identifying that this kid is not this has some sort of uh, dyslexia, I think, yeah, dyslexia, but he was very good at painting. So it came into existence when there was a painting competition, when he had shown his painting this thing. So that's what behavior traces, how we can understand the behavior. Then we have behavior observation. In some senses, behavior observation will form part of each and every assessment. In the present context, the word observation is used in a more restricted sense through referring or directing, recording, monitoring, describing, and operational classification so of human behavior. So nowadays, if you see, uh, there won't be much checking in airports and railway stations, but there will be surveillance everywhere, CCTV cameras, where there will be sitting psychologists who will be analyzing each and every person's behavior. If they find somebody something suspicious, they will go to that person only and check that. That's what behavior observation is. Even when a client is coming to a psychologist, there only the psychologists used to take the observation part as well. Okay, how he was sitting, what was the even in our mental states examination, we have that type of question. Dressing style, whether the client has combed the hair and all, so that all gives us the understanding about the disorder or problem. Behavior rating. In behavior rating assessment, a person is asked to evaluate his or her own behavior or the behavior of another person with respect to given characteristic, judgment scale, or checklist. If we want to rate the behavior, okay. So, for example, some kids, they are not behaving well. So usually we even used to do strategies that, uh, okay, so what we used to do is we will ask them, okay, if you do like this, then you will get one chocolate. Next day you will get something. You will get something. So that is again a behavioral, uh, how we can modify their behavior. But behavior rating is to what extent you could change your behavior. So if you had to sit, you are supposed to sit for your studies for this many hours. So rate today how much satisfied you are. Or rate today how much time you have spent it. Okay, rating from 0 to 5, 5 being very high, 0 being very low. So you can rate. That also helps us to. This is a method to be applied to concurrent behavior under direct observation, as in modern assessment center application, or and more typically to the rater's explicit or anecdotal memory of the ratee's behavior at previous occasion. So it will give us, if we are doing it continuously for 1 month, it will help us to see the trend, whether the therapy or whether the session is helping the client or not. It will show us trend, how much it is increasing or decreasing. Expressive behavior. As a technical term, expressive behavior refers to variations in the way in which a person may look, move, talk, express him or herself, uh, his current state of emotions, feelings, or motives, making a grim looking face, trembling, getting a red face. So, expressive behavior. That's what I was talking about when you see in railway stations and all these CCTV cameras. So, they will be observing the facial expression of the people. If there is any sort of change, for example, if I am carrying some sort of illegal thing, so I will be very much curious what if somebody is observing me. So I will be looking here and there. If somebody asks my name or something, I will get red. Okay, so that are the expression of behavior. When, how we can identify that. Projective techniques in 1930s and 40s. Many clinical psychologists, often influenced by psychoanalysis and other forms of depth psychology, placed high expectations in projective techniques. So, 1930s and 40s, psychologists have uh, influenced with projective techniques, and they were using projective techniques because sometimes it is very difficult to understand somebody's behavior, what is going inside the person. So projective technique even helps us to understand the unconscious thought, unconscious wish. So that's why it got it had got its importance over 1930s and 40s, believing that they would reduce a person to express his her perception of the ambiguous stimulus material, thus willingly or even unwillingly uncovering his her personal individuality, including motives and emotions. So, willingly or unwillingly, using the projective techniques, clinical psychologists use to understand the hidden perceptions of that individual that the person may not even be aware of late. So even person is not aware that what he is talking. When you might have seen Rorschach that pictures, when you are trying to perceive that, or TAT, when you are writing a story, so everything comes from inner. You are trying to unconsciously you are trying to connect that with your own. So by that way, the clinical psychologist is interpreting your behavior. Later in 1950s and 60s, research has clearly shown that such assessment methods not only tend to lack in scoring objectivity and psychometric reliability, but it's still more important, also turned out to be very limited validity, if any. Okay. So there were some sort of like criticism as well for these projective techniques, because the methods of understanding, it is too much subjective. How I perceive somebody's perception and how another person perceives it is entirely different. So to understand that, if you keep a glass in which half water is there, so some of us will perceive it half filled, some of us will perceive it half empty, and some will say it is half filled with water and half filled with air. So there are three different perceptions. Same way, in this also the perception varies. Furthermore, thematic association techniques like TAT maintain their status as assessment methods potentially useful for detect, deducing assessment hypotheses. In addition, specific TAT forms have been advised for assessing specific motivation variables such as achievement motivation in the clinical context. Once their prime field of application, projective techniques are no longer considered attainable by basic for hypothesis testing and theory development, let alone therapy planning and evaluation. So these tests, whatever project techniques have been used in earlier times, so we are not trying to test the hypothesis with these in the research. We are going to do the data collection for research purpose and all. But usually when client are having some sort of problem and they are unable to express, in that cases, clinical psychologists are using such assessments. Questionnaire. Originally, personality inventories, interest surveys, and aptitude or opinion schedules were devised as structured interviews in written from multiple choice responses. So we have questionnaires, we have interview schedules, we have multiple choice questions, so on and so forth. Even true false questions, yes no questions. Early clinical personality questionnaires like MMPI draw much of their items content from confirmed clinical symptoms and syndrome. So even whatever psychological tests we are using, for example, if you might have heard about BDI, back depression inventory. So all the items are based on the problems or symptoms of the depression. For example, insomnia. For example, appetite change. For example, gaining weight or losing weight. For example, feeling of guilt. For example, feeling worthless. Okay, so these are all symptoms of depression. On that basis, Beck has developed a scale on depression. So, whatever the characteristics in any particular problem, anxiety, depression, schizophrenia, on that basis only scales have been developed. Objective test. Test constitute the core of psychological assessment instruments. It is through them that psychological assessment has reached its level of specific credibility and wide range of applications. A test is a sample of items, questions, problems, etc. Choose so as to sample chosen okay in a representative manner. The universe of items, questions, or problems indicative of the trait or state to be assessed. For example, an aptitude or personality trait or a mood state like alertness. The adjective objectives refer to administer score and respond objectivity in test development. So objective tests are those tests which we are using to understand any sort of problematic behavior. So it will be having some options. It will give us more clear idea to understand any sort of either it's personality related issue or it is something. Yes, sir. You want to say something, Panu Prasad sir? Psychophysiological tests. Psychophysiological tests are, for example, you might have heard EEG, MRI, fMRI, MEG. So these are giving us just a second, just a second. Sorry. So psychophysiological tests are those tests which helps us to understand the nervous system based experiences, how hormones, immune system, uh, actually physiological process of our body. It helps us to understand that through different tests, even EEG, heart rate and all, fMRI, functioning, brain functioning. So we are getting data through these tests to understand the brain functioning, cardiovascular system functioning, you know. Okay. Practical applications. So assessment of intelligence and other aptitude test function is clearly this is the primary domain of objective behavior tests. The test of cognitive and other aptitudes were among the first methods of assessment ever to be developed. The German psychologist William Stem suggested an intelligence quotient (IQ) defines a tile ratio of mental age over biological age. So it was first by William. This IQ test has been given by William by the formula IQ, sorry, by the formula with biological age and mental age. So, biological age, considering biological age and mental age as a major concept of assessing a gross functioning like intelligence in a score that would be independent of the age of the person tested. Okay. When subsequent research revealed psychometric inadequacies with this formula, the US psychologist David Wechsler proposed in his test Wechsler 1958 an IQ competition as age standardized normalized standard score with mean of 100 and standard deviation of 50. So after the earlier IQ's calculation problem, then Wechsler, whose intelligence test is very famous throughout. Okay, so he gave different calculations. The ways, for example, contains 10 individually administered tests of two kinds: verbal tests, general information, general comprehension, digital span, then substitution, arranging pictures according to the tile sequence of a story, compiling pictures, moist test, block design, objective assembly of two dimensions. A person's test performance is assessed in three IQ scores wise: verbal performance and total IQ. Verbal performance. Okay. So what he did is he focused on intelligence is not like we can just identify by one dimension. So that's why they have incorporated like 10 tests in that ways test. By that they are able to analyze the IQ, overall IQ of an individual. Psychological assessments in clinical context. So, role of psychological assessments in clinical context means when uh, any psychological assessment. See, for example, a person is coming to me with symptoms of something. For example, not able to eat food, not able to sleep, and all. So, psychological assessment will help me to understand what sort of diagnosis I should give. Right. So that's what psychological assessments in clinical context plays an important role for diagnostic criteria. For example, the MMPI was a classical prototypal clinical personality test which, like the Wechsler test of intelligence, has frequently been adopted and translated into other languages. So, as they were famous, so they were always translated into different languages, so that can be used in different cultures, countries, as per the language they are using. In addition, the large item stock of MMPI, more than 550 items, has been utilized as a base from which a great number of specific questionnaire scales were developed. Perhaps best known among them is Taylor Manifest Anxiety Scale (MAS) by Taylor. So this is a questionnaire. MMPI was of 550 items. From that, different psychologists have developed separate tests. For example, this anxiety scale. Besides these broadband multi-scale questionnaires, numerous assessment instruments of narrowed focus have been developed. Examples are the Beck Depression Inventory, as I was talking about, BDI, Beck Depression Inventory, assessment instruments for studying phobia or obsessive symptoms are more recent introduced and diagnosed inference schedules implementing the DSM and ICD approaches of descriptive disease classification. So from these MMPI tests or other tests also, lot of other subtests have been, because these tests were giving us a profile, personality profile, or any sort of profile. In profile, it consists of different tests, right? So same way, what they used to do is, for example, I just need under about one particular aspect. For example, anxiety. So I will just use anxiety scale instead of using 550 items of full profile. I will be going for one test. Even when you are going to a physician as well, If you, whatever the issue is, they will be writing a particular test. They will not say, कि, okay, you have to do all the examination. They will say particular test which will help them to give the proper diagnosis. As per the symptoms, they will recommend you the particular test. Okay. Assessment in vocational guidance, testing, and job selection. So there are tests as well in vocational, whatever job you are doing or whatever courses you are doing. For example, if you have to counsel at ninth standard, 10th standard kid, which subject after 10th they are going to choose. So in that case, what you need to do. So there is a test in which there are two dimensions. One is aptitude and one is interest. So aptitude usually we can't change. For example, a student is coming to me saying that I am very much interested in engineering, but I am very poor in maths. To what extent he can go with that? Another is saying I am very much interested in MBBS but poor in bio. Okay, so aptitude we have to consider, keep into consideration both aptitude as well as interest. It's not interest only. For example, I am a social science student. I want to become an MBBS doctor. That is entirely different. My field was social science, and this need to be medical, for example, right? So we need to understand both interest. I want to become somebody, right? So interest and aptitude, these are two different things which we need to make understand the client, then only they should take the decision. Methods of behavioral assessment as well we can do by a number of questionnaires. Okay, so similar focusing on assessment or behavior. Self-report method, another important aspect is self-report method. So there are some interventions which are self-recorded or self-report inventory. A self-report inventory is a personality inventory in which a person is asked which are the list of traits and characteristics describes him or her, to indicate which behavior and hypothetical choices he or she would make. This type of test is often present in a paper and pencil format. So most of the psychological tests are in the format of paper and pencil. So self-report measures have been used by many researchers to assess the behavior, cognition, and affect. So we usually use self-reported questionnaires. Okay. Examples of MMPI 16 personality factors, schizophrenia, personality inventory, strength and weakness. Steps in behavioral interviewing: identifying the problem and specify target behavior. So when we have to understand the behavioral issue, so how we will interview a person with having behavioral issue? Identify the problem and specific target behavior. Specify target behavior. So first we need to identify the problem, and then we have to specify target behavior. What target behavior is? Identify and analyze relevant environmental factors. So we need to understand what are the relevant environmental factors which are responsible for this. Develop a plan for intervention. Being a psychologist, you need to develop a plan. Okay, so what all you are supposed to do for each session. Implement this plan. Then you are supposed to implement the same to the client. Evaluate the outcome of treatment. So you need to get feedback. You need to evaluate your daily sessions or weekly sessions about the progress. You need to get info. Modify treatment as needed and reevaluate outcome. So sometimes we are giving, you might have seen, sometimes we are going to a doctor, he is giving us some medicine and he is after 2 days coming, asking us to come back, and he is changing the medicine. Sometimes diagnosis may be different, or sometimes, for example, in one family there are 5 members, each one's choice will be different for their food dishes and all. Okay, so we need to understand which one they need. Same way, there are n number of therapies or behavior modification techniques. So which one is more suitable? We need to understand. Sometimes I am giving CBT for somebody for OCD. So, but more there is no much progress, then I can shift from CBT to REBT or SABT, some other therapy. So what if we get better results? So that's why feedback is important. Modify treatment as needed and re-evaluate outcome. So then we have to, in that case, modify the treatment and re-evaluate our outcome. Questionnaire rating scale already discussed. Direct observation and self-monitoring. Key characteristics of direct observation and recording of behavior. Behavior is observed in natural setting. What is natural setting? Natural setting is I don't know, but I am being observed. So natural setting means when you are not aware and you are in the way you are. If I am asking you that, if I am saying you that, okay, you are being observed, you will be very much formal, right? You will try to act or intend your behavior the way you want to show the behavior to someone. That's why behavior is observed in natural setting. Behavior is recorded or coded as it occurs. So when you are doing filling this mental states examination, or when you are taking any sort of interview, always it is suggested that you need to mention the verbatim of the client. Verbatim means even if they are saying something something, you have to write that two times something something. That is what verbatim is. To interpret it properly, we need to mention the verbatim. Impartial, objective observers record behavior. Impartial, so it should be impartial. Objective observers record behavior. Objective observers record behavior. So there should be. It's not ki I can put anywhere CCTV and observe. So I am getting the data. So it should be having that objective, which behavior and when we have to observe that. Behavior is described in clear, crisp terms, require little or no inference by the observer. So, behavior is described in clear, crisp terms, require little or no inference by the observer. I am not going to say you have to act like this. Okay? So, the way you are, you have to be in that way. Types of direct observation. Okay, there are two commonly types used for direct observation. Continuous monitoring. This involves observing a subject or subjects and recording their either manually, electrically, or both as much as of their behavior as possible. So, continuous monitoring means you are monitoring their behavior for weeks, for months. Continuous monitoring is often used in organizational settings such as evaluating performance. Yet this may be problematic due to the Wetron effect. The Wetron effect states that workers reacted to the attention they are getting from the researchers and in turn productivity increases. So if you know that I am assessing your behavior for 1 month, you may be trying to give the best in that 1 month, right? So that should not happen. So continuous monitoring means when continuously you are, for example, in organization one employee is there, we want to have continuous evaluation how much task is done by the evaluator, by the employer, right? Time allocation. This involves a researcher randomly selecting a place and time and then recording what people are doing when they are first seen and before they see you. They This may sound rather brisk, but it is a useful tool when you want to find out the percent of time people are doing things. So, for example, time allocation means when suppose you want to understand how people usually spend the time. So then, in that case, you can try to do that. Unobstructive observation. Unobstructive observation measures involves any method of studying behavior where individuals do not know they are being observed. Don't you hate to think that this could have happened to you? Here, there is not the concern that the observer may change the subject's behavior when conducting unobstructive observations. For example, somebody is working in the field from far, I am observing their behavior, how they are, but they are not aware about my observations. Behavior traits already we discussed, self monitoring, discuss field again, assessment and clinical. Definition of psychological assessment. The psychological assessment can be formally defined as many ways. Clinical assessment involve an evaluation of individual strengths and weaknesses. So, if we want to just define the assessment in clinical psychology, so it helps us to assess and evaluate individuals' performance, strength, weakness, a conceptualization of the problem at hand, as well as possible etiological factors. What would be the etiological? What would be the cause of this behavior or any particular behavior they have? Psychological assessments. Okay. Reliability and validity. Okay, very important. So there are some characteristics of a good psychological test or scale. So number one is it should be reliable, it should be valid, it should have norms, it should be standardized, it should be objective in nature, it should be uh, generalizable. Like we should be able to generalize it. Okay. So reliability. Reliability means consistency. So if I repeat back depression in inventory, whether I am getting the same result after repeating it different with different populations or not. What if it gives me one result for one population, then another result for another population, different? Or if I repeat it, whether it is giving me, if this is 1 liter in my VIT cabin, if I am measuring it in Vijayawada, whether it is 1 liter or not. If I am measuring it is in Guntur, whether it is 1 liter or not. So that's what, whether the consistency is there or not. Then validity. Validity means whether it is fulfilling the purpose what it is made for, right? Then we have objectivity. Objectivity is something which is very specific, so whether it has objectivity or not. Objectivity means, for example, as morning also I gave you one example. You had breakfast or you had lunch. You will say either yes or no. So it is very objective. If you are saying actually, sir, I was late, this, you are telling me a story. That is going to be subjective. So questions also should be very specific. If it is related to depression, so it should explain about depression only. If it is related to OCD, it should talk about OCD only. It should not talk about happiness, right? So that's what objectivity is. Norms, whether the scale has norms or not, because norms are something important which helps us. Okay, what is the age range this scale can be used? For each and every individual, there are norms. For each and every scale, there are norms. Gender norms are there. Even when you go for any sort of physical test, so if you see hemoglobin, so it should be 15 to 17 point in males, 13 to 15 point in female. So there are different norms of even hemoglobin in male and female. So same way in psychology, if this is the level, what level should be for male, what level should be for female. Same way with other tests as well. Age, as I mentioned, the different age groups are diagnosed with different problems. So each and every test or each and every psychological problem is assigned to a particular age. For example, autism. At what age? I can't diagnose somebody autistic at the age of 60 years old. I can't diagnose somebody at the age of 3 years old with uh, dementia or this Alzheimer's disease, right? So that are age appropriate. That's what there should be. That norms are there always. It should have that norm. Then generalization. Generalization is if I am preparing a scale for particular variable. Whether I am able to generalize it, okay. For example, I am preparing a scale on happiness. If it is measuring here in my college happiness, whether it is measuring in India whole happiness, in other countries as well. That's what generalization is. Types of psychological assessment. We have intelligence, we have personality, we have, there are a number of types, thousands of psychological tests exist, all fall in one of the following categories. So intelligence, cattle culture fair, cognitive abilities, then Likert scale, aptitude scales, personality tests, Beck depression inventory, child behavior checklist, Rorschach test. Again, it is a personality test. Direct observable tests at the present, such as the present parent-child interaction assessment. Then we have different batteries as well for this thing, uh, especially intelligence. Addiction assessment. The addiction of client functioning is a crucial component of both treatment outcome evaluation and assessment of individual's level of need for individual treatment planning and service delivery selection. This is especially true for the duly diagnosed client with multiple concomitant needs on variety of levels. The functioning assessment of mental health and addiction scale was specifically designed to meet both criteria. So addiction scale, we have this FEMA, so functional assessment of mental health and addiction scale. So each scale, when it is developed, the developer or the author of the scale always keeps in mind that what should be the criteria or what is the purpose to measure. So accordingly, they will be using the questions in that. Another is substance using patients. Uh, substance using mentally. Substance using mentally ill. SUMI. Okay. Several mental illness exist independently of substance abuse. So in DSM and ICSR, we have a separate chapter, mental disorder because of substance abuse. So this is MUSI is a test to understand that as well. Again, SUMI development. Okay, now another important aspect is development of a scale. How developers are developing a scale. So the example is here given: functioning assessment, family functioning assessment, mental health was developed by with a variety of criteria in mind to educate assesses MISU, SUMI, and MCSU patients in naturalistic settings. Specific criteria developed by Green and Greeley were include functioning domains that are okay. So when they have developed this, they have kept in mind all the related substance related disorders, because as we have seen MISU, this is also related to the addiction and all. So what all they need to keep in mind, they will keep in mind accordingly. They are going to develop the scale. Assessments in clinical psychology are written. Okay. Planning therapy. Planning therapy for patient who needs and wants to receive psychological treatment involves deciding on the appropriate setting in which to deliver the treatment. So first thing is to decide in which way you are going to deliver the treatment to the patient. Estimate the duration of the treatment. How much duration do you think the treatment will be able to recover for this? Even for this allopathy medicine as well, we will be having duration for 2 weeks, for 3 months, for 1 year. For some cholesterol, blood sugar or something, there are medicines which are for lifetime, right? So same way, therapy if you are giving, so you have to see the intensity of the problem, how much intense it is. Accordingly you will plan the treatment plan, selecting the particular type of treatment to be given. Conducting therapy. Psychological assessment can play a key role in conducting therapy by helping to identify in advance treatment targets on which the therapy should focus on. So there should be treatment targets. So a person is having this issue. So what is the target? First, the counselor or the psychologist is having to sort out the problem. So accordingly, they will go. Possible obstacles to progress towards these treatment goals. What would be the barriers or possible obstacles which will hinder the progress to reach the goal? Evaluating therapy. Psychological assessment provide valuable data for monitoring the progress of therapy and measuring its eventually benefits. For this potential benefit of assessment to be realized, it is vital for assessment data to be collected from patients prior to their beginning of treatment. That's why we need to first understand the client properly, then only we can begin with the treatment. In addition to helping to identify treatment targets and the long-term objectives of therapy, treatment data provided an objective baseline for comparison with the result of subsequent. That's why whenever we are going to doctor, they are asking us whether you had consulted earlier someone, how long you had taken the medicine. So same way in psychology, when we are conducting any sort of therapy, we also get the information whether earlier there was, because if earlier the same therapy has been tried and again he is coming, he is just changing the psychologist. Again, we need to work on that. Ethics in assessment. Another very important point, which being a psychologist or clinical psychologist, we need to keep in our mind are ethics. Because if anyone who is not following the ethics, there is a possibility to be behind bars. Okay, so you might have heard recently one psychologist from uh, Nagpur, he was abusing some client, so he is now behind bars. So we are supposed to be very much specific to the ethics. We need to like follow it like anything. There are 10 common fallacies and pitfalls that pollute psychological testing and assessment. They are mismatched validity. So it should not be mismatch. Mismatch validity is one time it is showing something, another time it is showing another thing. There should not be any sort of mismatch. Confirmation bias. Confirmation bias is, for example, I am a doctor, I gave paracetamol and I am expecting okay, it should reduce your headache, so this is my expectation. So I will say you that okay, your headache is now reduced, but you have fever. Or whatever entry you are giving, we are changing that. That's what conformity. I want to prove that my quality, whatever I am giving you, is the best thing. So that is what confirmation bias is. Then we have confusing retrospective and prospective accuracy, switching conditional to probabilities. So that also comes under ethics. Under standardizing tests, standardized tests, unstandardizing standardized tests. Okay, so when even when you are using a psychological test, if you are not following the steps given in that, the norms given in that, it means it is not a standard. Then you are unstandardizing standardized test. I am giving you a standardized test. For example, doctor is giving you a medicine to have before meals, if it is a S-log or something which is related to stomach, but you are having it after meals, so whole purpose is gone, right? That is what I am saying you, you should use it on male population, you are using it on female. I am saying you it should be used on adolescents, you are using it in adulthood. So that is what under unstandardizing standardized test, even though it was standardized, but you are unstandardizing it by not following the norms or the instructions given. Ignoring the effect of low base rate. When you are ignoring effect of low base rate, misinterpreting dual high base rate. Again, if there is misinterpretation, you are not perceiving the way it is supposed to be perceived. Perfect conditions policy. Then financial bias. Again, just for money and all, you are showing the results like this. Ignoring the effect of auto recording, video recording, or the presence of third party observer. If you are ignoring the effect of auto recording, for example, usually when it comes to camera, people act very uh, like formally in terms of video camera or audio it is, right? So that also you need to keep in mind. Then uncertain gatekeeping, when you are not aware about the proper this thing, how you are going to take it. So mismatching validity, I have given some examples as well here, which I discussed. Conformity. Often we tend to seek recognition and value information that is consistent with our attitudes, beliefs. We always have a belief, okay, it should work. So when it's not working, it's not confirming our this thing. So that's what conformity bias. We manipulate the results as per our test construction. So ignoring the effect of this. Psychologists who conduct assessments are gatekeepers of sensitive information that may have profound and lasting effect on the life of the person. Again, the information you are getting, so you are the person who are supposed to keep it high. If you are misusing it, that will also lead. So there are a lot of cases in India. Even I have seen that people are getting terminated because of this thing, yeah, breaching the confidentiality. People are blackmailing. Even this case in recently Nagpur case, same thing happened. He was blackmailing his clients. API ethics code, ethical principles. Competence. Psychologists maintain high standard of competence, including knowing their own limits of expertise. So it's not that I am saying, okay, I am expert in family therapy, for example, and I am starting CBT, cognitive behavior therapy, something else. I am expert in CBT. I am including into hypnotherapy or something else. So the competence should be there, right? Applied to testing, this might suggest that it is unethical for the psychologist to use a test with which he or she is not familiar to make decision about the client. So I don't know any particular test in psychology and I am conducting that, which I don't have any idea how to do and how to conduct it. Then integrity. Psychologists seek to act with integrity in all aspects of their professional roles. As a test author, for example, psychologists should not make unwarranted claims about a particular test. Again, being a psychologist, you need to maintain that integrity. Professional and scientific responsibility. Psychologists uphold professional standards of conduct. In psychological testing, this might require knowing when test data can be useful and when it cannot be. This means, in effect, that the practitioner uses the test needs to be familiar with the research literature on the test. So, for example, somebody is coming, I am asking, do all the tests on that person. So, they have to pay a huge bill. So, instead of that, I should be knowing, okay, these are the symptoms, there are chances of this thing. So, I should give test on that basis only. Even when you are going to medical, if you give the symptoms, they will write the test according to that symptoms only, where all these symptoms may fall under. Respect for people's rights and dignity. Being a psychologist, we are supposed to respect others' privacy and confidentiality, especially of our clients. Concern for others' welfare. Psychologists are aware of situations where specific tests, for example, ordered by the courts, may be determined. So, for example, this lie detector test I was talking about, you can't easily call anybody, okay, I am going to check your lie detector. You need special permission in that case. Court has to give permission about that. Social responsibility. Psychologists have professional and scientific responsibilities to community and society. With regard to psychologist testing, this might cover counseling against the misuse of test by the local school. Okay, so social responsibilities. Being a psychologist, you have a lot of responsibilities. So you need to carry forward in such a way it should not hurt anyone else. Ethical standards. Okay. Objective of psychodiagnosis. Difference between psychodiagnosis assessment and psychiatric consultation. Okay. Do you guys know what is difference between a psychologist and a psychiatrist? Anyone can answer me this question? Difference between psychologist and psychiatrist.
Psychiatrist is a physician, sir.
Psychiatrist is a physician. Okay.
He treat the serious psychological disorder.
Psychologist can't prescribe medicine. Okay.
Psychiatrist prescribed the medicine.
Okay. Psychiatrist describes medicine. Okay.
Psychologist, psychologist is a therapist.
Psychologist is a
Therapist.
therapist. Very
Huh?
good. 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 Okay. Good. So you know that. Okay. Good. Okay. Areas to be covered in diagnostic interview. Identifying information including client sex, age, social race. So all demographic variables are being incorporated in identifying information. First initial stage only. Presenting complaints. Then another thing is what you are feeling now. What are your complaints? Not able to sleep, whatever. Presenting appearance. How do you appear? Like the dressing style, the way of talking, the way of sting, way behavior, participating precipitating factors and history of the problem. What could be the precipitating factor? What could be the responsible factors which are leading to this disorder or problem? And history of the problem. So that also we need to understand. Then history of the person, overall history. Even when if you see mental states examination from even prenatal development, we have to take the history during pregnancy, how the mother was, what were the circumstances. That also helps us to understand the behavior of the person. Developmental history, different milestones, whether the kid, as a kid, the baby was able to fulfill different milestones or not. School history, how was his school achievement, problem, aspiration, significant relation with authorities, other figures. Peer relation, how good he was with friends, social settings, and all. Sexual history, early childhood memories, traumas, that all we need to understand. Work history, medical history, analysis. Okay. DSM-4 TR diagnosis. A 6-year-old child is having trouble in school. Question that diagnosis assessment can answer include the following example. So there is a given example. Just see how we are going to overview this. A 6-year-old child is having trouble in school and not staying in his seat during lessons. Does the child have an attention deficit disorder, an anxiety disorder, or conductive disorder? Now, when you understand the chief complaints of an individual, on that basis only you are going to give the diagnosis. 1 second, there are some disturbances. Sorry, there was a network issue. Yeah. Am I audible?
Yes, sir.
Yes, sir.
Okay, okay. So see, now there is a condition. 6-year-old child is having trouble. So what do you think? What diagnosis would you suggest to give the child? Which disorder it may be? We have only
Please
one
repeat the,
symptom. Hmm?
please repeat the question, sir.
It is a 6-year-old child is having trouble in school and not staying in his seat during lessons. Does the child
Hyperactive.
have?
Hyperactive. Hyperactive.
Okay, so if we even Soma, just mute. Yeah. Do mute your mic. Yeah, thank you. Okay, so anyway, it is not conduct disorder. Conduct disorder has different. If there is a symptom of stealing something and all, so then only we will say conduct. So conduct it will not come. Anxiety at childhood it will not 6 years. So there is a potential of having ADHD, attention deficit disorder. Okay, a 60-year-old female has been increasingly forgetful, less energetic and confused. Is she depressed or suffering from the onset of dementia? So
Onset
here,
of dementia.
dementia. Yes, you are getting my point. That's why I was talking about the. Please mute again because there is some noise coming on again. So that's why I was talking about the age is very important to understand. Why is the 35-year-old man having chest pains and rapid heart rate without any biological explanation for these symptoms? Okay. Answering
Anxiety.
such questions through diagnostic assessments may lead to recommendations for treatment. Establishing a client's eligible or ineligibility for disability services, disability accommodations, reimbursement from insurance companies, or simply increase understanding of patient symptoms, which will enable other healthcare practitioners to work more effectively with them. So answering these such questions, it will help even to the client to think about the policies or about the future of his family. It will also help the professionals or the clinical psychologists to how to go ahead. So yeah. Then the diagnostic classification DSM IVTR is categorical classification system. The categories are prototypes, and a patient with a close approximation of the prototype is said to have that disorder. So when a client is having like closeness towards some sort of diagnostic criteria, okay, then only it will be diagnosed with that sort of disorder. With qualifiers, for example, mild, moderate, or severe forms of disorders, for nearly half of the disorders, symptoms must be sufficient to cause clinically significant distress or impairment in social occupation or other important areas of functioning. Although DSM TR removes the distress criteria from tic disorder and serve of the paraphilias. So, what even I was talking in morning, so it should have like 1 second. For example, I was talking about back depression inventory. So, all the symptoms in DSM as well as in ICT, there is a differential diagnosis as well as diagnosis. Okay, so diagnosis will be made only when the symptoms, for example, it will be written out of these 5 symptoms. If the client is having 3 symptoms from last 3 weeks, then we will be diagnosing with this particular disorder. So that's very important to understand. The diagnostic criteria for each disorder, including DSM, includes a set of diagnostic criteria, including symptoms that are present and for long, even duration, how long it has been. That is also very important. It's not from last 2 days. I did not sleep. I was attending marriage function or something. So I will go to a doctor that I have insomnia or depression. That's not the case. It can be because of the fatigue, because of the work I have done in the party or something like that. So we need to be very careful with that diagnostic criteria. Descriptive text, the third component of DSM, is the descriptive text that accompanies each disorder. So the text of DSM systematically describes each disorder under the following heading: diagnostic features, subtypes, and specifics. Okay. This we already discussed. Axes we also discussed in morning. Yes. Okay, personality assessment, definition of personality. So, if you see as per Alport, personality is dynamic in nature. So, as per Kraepelin, various theorists have defined personality in many ways over the many years that the discipline of psychology has evaluated. Most definitions and theories have argued that personality refer to stable, enduring characteristics that uniquely defines individuals' way of being or the viewing life situations, the world, and the others in it. So it is done given by Kraepelin. There are other definitions as well, which talks about dynamic nature, dynamic behavior, and all. Temperament. This refers to a person's disposition and is often assumed to be largely biological. So temperament is always considered as biological determinant. Much research on temperament have been conducted on infants and children. Equating temperaments with personality may be appropriate according to some psychologist theories, especially those rooted in the psychodynamic traditions or medical models. So, those who believe in psychodynamic traditions, psychoanalytic models, as well as medical models, are believing in the temperaments. And there has been studies in infants and children which have talked about the temperament. Trait refers to the individual's relatively stable ways of thinking or behavior. So their disposition that develop over time. The term trait implies that the environment and one's interaction with it or others may formatively develop one's personality. So temperament is within us. It is from birth only. It is through biological determinants. But traits are something which we are getting through the interaction with environment. That is the major difference between trait and temperament. Behavioral assessment, again, how we are doing behavioral assessments in school, college, or as childhood with different questionnaires. Psychodiagnostics. Okay, this is a branch of psychology concerning with the use of tests in the evaluation of personality and determination of factors underlying human behavior. Okay. Okay, stages in psychodiagnostics. Sandberg and Taylor describes the course of clinical assessment as a flow through four major stages. Preparation, in which the clinician learns of the patient's problem, negotiates the referral, questions and plans further steps in assessment. So this is preparation, how I am going ahead with the plan, what I am supposed to do with the information which I got from the client or from the referrer. Referrer is one who is referring. It can be parents, it can be other doctor. Sometimes you might have seen doctor, one doctor is referring, go to that other department. So same way here, referrer is, it can be a friend, it can be anyone who brings the patient to the client, the counselor or clinical psychologist. Input, during which data about the patient and his situation are collected. Inputs are whatever database we are collecting directly or indirectly about the patient. If you have watched the movie Bhool Bhulaiya, Akshay Kumar's first one. In that, about the actress, there is a problem. So he is going to his village to collect the information. So we don't have to rely. Sometimes, see, if I am doing something wrong, I won't say this, it is my fault. I will try to hide my part. Okay, so it is very important to get the information, exact input from different sources. Processing, during which the material collected is organized, analyzed, and interpreted. So, whatever information I have collected, I am organizing it, especially in movies where there is a, for example, some case solving movie. Okay, for example, some murder they have to solve. So they will be collecting all the evidences, then they will be connecting each point to solve the case. Okay, same way here, we have to collect all the information, organize it, analyze it, and interpret it, and output, during which the resulting study of the person is communicated and decision as to further clinical actions made. So now I understood a person, I collected a data that this person has these symptoms, so he may be having anxiety. Now I am done with what would be the consequences and everything, processing is done. Now output, which therapy I am going to plan with the client to overcome from the anxiety. That is output. Step by step procedure in psychodiagnosis. State the client's name, age, date of evaluation, examiner, documents of the reason. If I have seen, or even if when you are going for internships and you are going to collect data from clinics and all, you will be able to see. So first, whenever a client visits us, we will be taking all the demographic details from the client. Then we will be taking the summary story, telling everything what happened in detail since birth or sometimes before birth. If it is a child, if it is old, then we are not like that much bother about the prenatal development and all, but still we will be asking some sort of questions. Then summarize background information on the client. This report section should be broken up into categories or related information such as medical condition, test, medications, clinical history, developmental milestones, education, behavior, social situations, and family. Each subsection should be presented in chronological order. So it should be in chronological order. Provide client information details extracted from interviews with parents or family members that were part of the evaluation procedure. So even we are supposed to collect whoever is accompanying the client to the counselor or clinical psychologist, we are supposed to take the information from them as well. Because in some cases when there is a client in schizophrenia or some other cases where insight level is 1 or 0, like when they are in morning I was teaching denial phase, so in that cases it is better to collect the information from person who refers to them or the person who is accompanying them to the clinical psychologist. Okay. Then report on your observations of the client during testing and interviewing. So then we are supposed to report each and everything, whatever observation we have made, whatever the results of tests have been got. If evaluating a young child, include data on free play, behavior, and interactions with parents and siblings. So if it is a child, you have to do that. List tests used, because your report may be read by non-professionals. It is helpful to provide a brief description of which test each test measures, what each test measures, report test result. Even nowadays, if you see, when you are going to any sort of medical checkup, they will be giving you, okay, this is lipid or this is something. So what is your score and what should be the average score, what is high score and what is low score. So even layman can easily understand which uh, aspect I am having less something or which aspect I am having high, and which all our aspects are normal. So same way we have to give in clinical psychology report as well, which one is what, right? Okay. Interpret the test results. The crucial section of the report can be approached in several ways. You can report the meaning of the results of each test, tie the results in the initial reasons for evaluation, or integrate the results by category, such as intellectual ability, competence, interpersonal skills. So you have to mention each and everything: neuropsychological factors and mental status, MSc, mental status examination. Then seventh is write a summary and recommendations. So now you have to give a summary. You might have seen doctor writing a 46-year-old male from village urban came to visit. The chief complaints of the client are this. Then they will suggest or recommend some sort of tests. So same way here also we have to make a summary about the client. Acknowledge the confidentiality of the report information on each page. Print the report on letterhead, stationery. Sign your name and provide your professional credentials, including license number and licensing authorities. Okay, then you have to give the report the way we are getting from physician doctor. If we are doing any sort of test, same way we are supposed to give the report. It should be detailed report. Mental states examination. So this is again part of the interview only. Appearance, aptitude and motor activities, dressing, grooming, signs, behavior, mood and effect, speech quality, thought content, dietarian stage in psychodiagnostic. No, there is some mistake in this. Okay, thought form, then perception. Then we have, if there is any negative history. Negative history means any psychological illness has been earlier found in the person. Guilt, energy, appetite, psychomotor. Test batteries. Okay, so this is mental states examination, which helps us to understand in detail the developmental milestones of the individual. Typical information requested during a standard clinical interview. Identifying information, name, age, this is okay. Demographic, referral sources, who have referred you, person, referred the person and why. Chief complaints, family background, health background, education background, employment background, developmental history, as I said, sexual history, previous medical treatment, previous psychiatric treatment, history of traumas, current treatment goes, if there is anything, that all. Although there is no specific formula for developing a report, several principles are generally followed. So these are the six principles which are supposed to be followed. There is not a particular format, so it varies from clinical psychologist to clinical psychologist. Principles of attention. First, the professional must be attentive. She must listen focusedly, complete attention on the patient without interrupting from distractions such as telephone calls or other concerns. So, first principle is attention. So, whenever you are dealing with the client, you need to be attentive. Principle of friendly posture. It should not be you are talking to a stranger. It should be friendly posture. Yes, okay. Can you go ahead? What else is there? So, in a friendly way, not in a rude way. Then principle of listening. You have to actively listening with patience. Then principle of being non-judgmental. So whatever it is, we are not supposed to be judgmental. The psychologist is non-judgmental and non-critical when interacting with patient, especially in regard to personal disclosure. So a client is saying that I had a boyfriend or a girlfriend, you should not be judgmental, it means something else. Okay, so we need to be very much specific in that term. Then principle of empathy and respect for the patient. So we should feel if a client is crying that my grandfather died or my relative died. You can't ha 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 ha. You can't give that reaction. So you have to show them empathy. Oh, I am feeling sorry. I do understand. It is a pain actually. This. So you need to show them that empathy as well. right? Principle of creating a supportive profession. So you also have to create a supportive professional respect and full environment which will help the patient feel comfortable. That's why even earlier sessions I was talking about, until and unless you are not giving the comfort zone to the client, even sometimes it will be very difficult for the client to reveal the actual position in second session as well. So now it is the efficiency of the counselor to how fast he can get to the main point what exactly is. So sometimes someone client will come, actually sir, my friend has this issue. So first they are not assured about the confidentiality, they are not assured about the skills of counselor. That's why they are making up the stories and portraying that. So you need to be very much smart in that way to understand, okay, how to make them reveal everything, like what actually the problem is. Otherwise it will be very difficult. Report writing and recept Receipt of report, okay. Length of the report, it should not be very much lengthy. You have to write it in specific pages. Degree of emphasis, to what extent you have to give emphasis on particular problem, that also you need to be very much specific. Domain is the interpretation are ideally presented and organized around specific domains. The selection of which domain to include should be driven by the type of question the reference sources requesting. So what actually they need, we have to give them accordingly, or what is their concern, we have to do that accordingly. Deciding what to include, so what to include, what not to include, that also we need to decide. Raw data and quantity score. So generally raw data and quantity score should be avoided. So raw data, if we are giving for example mmpi, they got this raw data, so they don't know how to convert it into percentile and what will be the interpretation. So it is better to give the data in that form where they can also be able to understand. Client feedback. One of the crucial role of the psychologist report is to assess in providing client feedback. That's very important. You need to have that client feedback as well. This is in accordance with client advocacy legislation and the APA ethical guidelines. In the client should know the type of information and recommendation being made about and for them. Send feedback is Such feedback is expected to be clear, accurate, direct, and understandable. So it should be direct, clear, and understandable. Okay, so here we will stop. History, I will send you again. Like when did this all psychological tests have been developed? Rounds, progressive metrics, then overview of tests, analog measurement of memory and creativity, how we are testing memory. There are different types of memory, that creativity, seizure. Okay, so with this we'll stop here. Now do you guys have any question? We'll try to discuss that. If any suggestion, any feedback.
Yes, students, if you have any clarification, if you need any clarification or if you have any doubt, you may ask, sir. Sir, I think they are clear with what you have said.
Okay.
So, shall we wind up then?
Sir,
Yes, yes, ma'am.
Yes.
sir,
Thank
what
you.
are the types of projective techniques?
Projective techniques are like we have this Rorschach is projective technique, TAT is projective technique. Another is sentence completion test. That is also projective test. Then we have a children's apperception test, CAT. That also is there. There are few more. These are what I remember right now. There are one or two more as well.
Sir, whether there is any Prescribed tests are there, sir.
Sorry.
Personality tests are
Your
prescribed.
voice is not audible, please.
Personality test is what?
Prescribed tests, sir. Questionnaires.
See, there are n number of personality. If you might have heard about big five factor of personality, ocean, ness, then see conscientiousness, self-efficacy, then neuroticism. That is what a big five factor personality is the most used personality test. Then we have 16 PF, 16 personality factors. Then we have MMPI, that is also a personality test. Then we have Eisen's personality test. Then we had this thing, personality type tests like introvert, extrovert. Again, I have mentioned the names of personality tests as well in the slides. Okay, I will be sharing with Prasad sir. He will be sharing with you.
Thank you, sir. Thank you.
Welcome. Thank you so much for listening patiently. See you in
Hi,
next
sir.
class. Yes,
Hi, sir.
yeah, yeah.
Sir, I'm Suresh. I was not there in the morning session.
Okay.
And okay, sir, and two things I have a doubt, sir. And now I think, as per my knowledge, I have. Well, now we are following the DSM-5 TR, and now we are in the test in the equity syllabus. We are everything we are studying about the DSM-4 TR. So, is there any contradiction or is there any problem with that?
See, if you give reference that you have taken it from DSM 4 TR or DSM 5, so then there is no contradiction, because whoever is checking your paper, they will see from where the content has been taken. So you can mention even ICD 9, ICD 10, ICD 11, that's not a problem.
Okay.
Even for example, if we have personality, so there are n number of psychologists who have given definition of personality, so you can write anyone's definition. Okay, if you give name and year, then you will get good marks, full marks in that.
Okay.
But you need to be
Okay,
aware
sir.
about who has given. Yes.
Yes, sir. Sir, in the clinical settings, especially when we are doing an internship or in a clinical settings, actually, what we have to now which we have to follow with terms, because yeah, as per my knowledge, for the mental retardation now DSM-5 TR we are using IDD, intellectual development disorder, like that. So during a clinical settings, actually, how we have to use the terms and all.
Okay, so again, it will be always try to go with the like upgraded one. Always try. For example, this course was created at the time of DSM 10, so they have given example of DSM 10. Now DSM 11 is available, so it is better to go with DSM 11. So whatever is upgraded, why we are upgrading, because sometimes there may be some feedback as per the population when researches are happening and all. So on the basis of that only, we are either adding some things or some components in particular disorder, or subtracting some things, or sometimes we are changing from one axis to another axis some particular disorder. Okay, so it is always suggested and better to go with the updated one.
Okay, thank you, sir.
Welcome.
So could you please share your contact details?
No issue.
Okay, sir.
Thank you.
Thank you so much, sir, for sharing your time. Sorry, for sparing your time and taking the sessions. Hope to see
Welcome,
you
ma'am.
soon again in the next future sessions.
Sure,
On
ma'am. Sure.
behalf of RC Vijayawada, once again I thank you, sir.
Welcome, ma'am. Thank
Okay.
you. Thank you for giving me the opportunity. Chalo, all the best to all students. Bye. Thank you, ma'am. Bye.
Bye, sir.
Thank you, sir.
Thank you, sir.
ఏసీలు హైలో తెస్తారు శాలరీస్ ఎట్లా మన జీతాలు వాళ్ళ జీతాలు